And I am delighted to welcome our first speaker. Dr. Judy Monroe is Chief of the Office of State, Territorial, Local, Tribal Services. And this is a new entity developed by Dr. Frieden when he came here several years ago, which has been extraordinarily helpful, I would say, from my perspective of someone who was a division director and now works at a center level in creating a part of CDC that helps us bring together the ways of enhancing our interactions with the health department partners who are so vital to getting the work done. Dr. Monroe has not only got this really vital perspective from what we call OSTILTs here, but she was formerly a health commissioner in Indiana, and before that was in the trenches of primary care when she ran the Indiana University Family Medicine Residency Training Program. So it's terrific to have Dr. Monroe join us to talk about the role of public health leaderships in implementing recommendations for Hep C testing and linkage to care. Dr. Monroe.
What I want to talk to you about over the next few minutes is from the perspective of OSTILTs and the perspective of someone that has been in clinical medicine and as a state health officer, what we might do through OSTILTs and here at CDC working with folks to put together, it's always fun, isn't it?
It is.
To put together tools for the states to help advance the Hep C recommendations. Okay, well anyway, so the role of public health leadership, I mean, what is that and how might we think about this, especially with all the linkage now to care? Okay, so there's my second slide. And so we are talking about this cohort. I think it's rather interesting that I think there's a real opportunity here when we talk about Hep C because we are talking about the baby boomers. And as we talk about this cohort of adults that now are in interesting phase of life and an important phase, and they have such a force in our society, I think we owe this to them. Now let's see if this is going to let me do something. And as we know, baby boomers are out there doing a lot of different things, right? So we want to keep them healthy. But we also, I found this, I just wanted to show this. I haven't read this book, but I thought it looked pretty good, this leadership book about know what you don't know. And so this really is the tip of the iceberg, right? We've got the baby boomers out there, they're enjoying life. Many of them are retiring or they're in leadership positions now in their roles. And we know that there are a large number of them that don't know that they're Hep C positive, and that would be important to know. So what's our role as health officials to help them with this? And so I wanted to talk first about the Bully Pulpit. And I had my staff put this in. This is a great slide. I mean, those of you from ASTHO or health officers, these are a few of our, of course, now some of these are health officers that have moved on to other parts of their career. John Auerbach from Massachusetts and Karen Rimley have moved on, and Mary Selecki, here she is on Fox News. I don't know if she's talking here about measles or if she's talking about pertussis or if she's, who knows what Mary might have been out there talking about. And David Lakey from Texas. So I was really impressed when I transitioned from being a primary care physician, taking care of patients, and I will tell you, I certainly had patients coming in that I found either incidentally to have Hep C that were in this birth cohort that I took care of, or they might come in with some early symptoms, fatigue or whatever it might be, that we would discover this, but they had no idea that they had Hep C. But as a physician practicing, I had a pretty narrow and limited opportunity, quite frankly, to get messages out. I'd talk to folks within my own patient population. If there were particular messages we wanted to get out, we might send letters to our patients, but it was really limited. And then when I became state health officer, I realized this Bully Pulpit. And it can be quite powerful. And I think that where a lot of health officers during the time that I was in office, H1N1, I think, gave us a lot of real important lessons on how to get messages out, how to get a lot of earned media, and that's something I want to talk about here, is how do we do this with limited resources, because we don't have the resources to advance things. So let me give you just a quick example. My husband is a physician. He's internal medicine. He tries to keep up with things. He's actually a vice president of medical affairs at one of the large hospitals here in Georgia now. And as I was preparing my remarks, and he heard me talking about the new recommendations, he goes, I didn't know there were new recommendations on Hep C. I had no idea. So this was last evening, so I got a little curious about that. So I went out and I did, a little bit of scan of what's being discussed about the recommendations. And I ran across one article from Arizona where they made the comment in the article that in their clinic, they had not seen an increase in testing since the recommendations came out. And we know that there's a lag time, right, between recommendations or any standard setting. We know, in fact, it can be years sometimes. So how do we accelerate that? How do we shorten that? And how do we do it with limited resources? And I believe the Bully Pulpit, for starters, is a great place to begin. But it doesn't stop at just the Bully Pulpit, because when I was in Indiana, if I had a particular message, and I'll use H1N1 as an example, but it's certainly not limited to that. If there was something that we decided was really important to get a message out, then my senior deputy might carry that message to particular audiences or messages. Medical directors might carry that. Program staff can carry that. If you're really good, you get the governor to start carrying your message. If the governor's a baby boomer, maybe the governors in the state need to get their own Hep C testing and model that. They get their flu shots, right? And so that would be something that we might convince the baby boomer governor to do if they understand these recommendations. So what I wanted to have some dialogue with you about is, would it be of value for OSTILTs to work with our colleagues in Hep C to put together, realizing there's limited resources, put together basically a toolkit or a technical package for the states that would make it user-friendly to help use the Bully Pulpit in a variety of ways. And if this works for Hep C, maybe this is a model we should be using for then the next disease and the next one, and begin to package this so we make it easier. Communication is really the key here. And so what I'm, in my mind, and taking from my own lessons when I was a health officer, I was thinking, you can, if we start here with the radio there at about, what time is that, 11? Yeah, at 11 o'clock there, the radio, I was real impressed as health officer how radio stations were always willing to have you come and talk about a particular topic. Small radio stations, if you really want to reach the populations, and you can do that from your desk on a telephone. You can be on the live radio spot, and you can talk about whatever the topic is to get the message out. So if we're trying to reach the baby boomers, they need the message that they should be tested. That's an avenue, and it doesn't cost anything. It does cost a little bit of time. So the question would be, would it be helpful if talking points for a radio interview were already packaged and put on our website, and it's ready to go? So if you get the radio show, and would it be helpful for us to give tips on how to get these radio spots, lessons learned that we could draw actually collectively how folks have done that. So so that's one thought. The microphone up top there, certainly if you're using the Bully Pulpit, health officers as well as others in state health departments have a great opportunity to give a lot of talks. Depending on the talk, you can include, the talk wouldn't even have to be exclusively about Hep C, but you could carry the message about these new guidelines and package that. So again, are there PowerPoint slides that we ought to have packaged and ready to go so it's user-friendly? Your staff doesn't have to, we don't have to recreate the wheel, we standardize that, and we have this in a toolkit for you. We have the newspaper up top there. Somebody's made a boat out of it or a hat or something there. My staff likes to get creative with my slides, but with newspapers, when I was health officer, I remember writing some op-eds about particular topics that would end up being in every newspaper across the state. I remember writing one time about asthma, and it got picked up across the state. So is that something that if we wrote the base of that, and then folks can tailor it, customize it, if you have that base already written for you, then it makes it easier for you and your staff, and we all save money. We're not all spending all this. So that was a thought. Certainly press releases, so having the I think they call them Swiss cheese press releases or something, having press releases about, this. I know newspapers have cut back, so I don't pretend to know what's happening with the local newspapers, because I know they were cutting back in Indiana when I got ready to come here. But we had some reporters that were always looking for kind of a new angle, and I think the whole baby boomer cohort here is one that really could gain some momentum from some of the reporters. And then that generates, of course, if you get the press release out, that generates, I remember my phone would start ringing, or I'd get the request for further interviews once that went out. So does that help you? Of course, social media at the bottom there is something that I know OSTLTS is trying to work on. I'm sure that ASTHO is involved with that, and we work closely with ASTHO in OSTLTS. So there's probably lots of things we could do there. The tweets, I don't know how many health departments are doing tweets, and Dr. Frieden is out there tweeting now on a variety of topics, and so that's something that could be done. The clicker here, I think that's television, or probably representing, the media there. When I was a state health officer, and I just throw this out for, because we relied on the full staff across the health department to do this, but I started something called RX for Indiana, because I realized that I wanted to be more visible about public health issues, and we didn't have a lot of money to do it. So I just started putting together, again with staff, a prescription once a month. It was a prescription for Indiana, and we would take one week it would, or 1 month it might be HIV, and we always did the rule of threes. So the prescription would come from the state health officer. We had a little prescription pad. It looked like the prescription pad, and we would put out whatever the 3 things that we wanted folks to know about, and then link that to more information. One of our large local television networks picked that up, and so every month I went and met with the health reporter and would talk about whatever the topic was that month. Completely earned media. We didn't pay anything, and it became routine. And I'll tell you, one of the times when I went there to talk, I remember the reporter saying, "Thank you so much for a couple of months ago when you talked about suicide," because they had within the television station on their staff, one of the staff had a teenage son take their life by suicide, and the materials we'd put out 2 months before had actually been very beneficial to them as a staff. So I remember being thanked by that. That leads me to the stories that you might have. There's nothing more powerful than the local story. I know, looking at a lot of the websites, there are stories out on the web of individuals that have Hep C and have gone through their treatments and so forth, but there's nothing more powerful than if you have someone locally that has been diagnosed that's willing to tell their story that you might link to as well. And a lot of this can be honestly, it can be very enriching, because you're not just carrying the message of the day, the recommendations on Hep C, but you're also carrying a public health message the more that you're out there. And so I know this was actually one of the areas that I found to be really rewarding as a state health officer, was that ability to use the media. And then the other is this integration of medicine and public health that we want to make sure that we're paying attention to. So let me quickly run through a few things here, and then I'm going to turn things over to Jose Montero, who I think is on the phone, to talk about the President's Challenge, because Hep C is one of the really powerful topics for this integration of medicine and public health, which is a top priority for CDC and taking a lot of attention across the nation by many thought leaders and associations. So as we build our tools to help you all carry your messages here in OSTLTS, I would invite you to model those or to adopt those. And I just wanted to catch these a little bit. We have built a STILT gateway, which we will make sure that all the Hep C materials are linked to this, so if folks come here, they find everything easily. But you might, I don't know how your own websites are modeled, but getting Hep C onto your websites, making it user-friendly, especially for your providers. And then one of the things you might want to do is model what we've done. We do national town hall meetings on our vital sign topics, which have been well received, and we're getting more medicine folks on these calls along with public health. But you might want to do, as a state health department, you could convene a call with your medical practitioners, or you can send messages. And Karen Rimley was one of the health officers that did this really well. And again, in the toolkit, we could help you by writing a dear provider letter, or dear, your medical professionals. Maybe we write the draft letter for you, and it comes out from the health official in your state out to all of your licensed professionals about the awareness. So you want to reach the public. I think we need to reach the baby boomers, so they're asking for the testing. And then obviously we need to reach out to our providers and have that strong linkage. Obviously hospital associations and others can help move things along. But this might be a model. I'm going to go quickly here because I know I want to turn over to Jose. We will be carrying messages through our weekly Did You Know on Hep C. We'll be aligning a lot of the communications here at CDC to help advance the message. But you can also syndicate this, so you don't even have to, if you're not already syndicating Did You Knows on your website, you can keep up to date without any added work. That talks about the syndication. And then Have You Heard is a model where we talk about what's happening in states. So as you all do work on Hep C, we want those stories so that we can disseminate your stories and your successes through Have You Heard, which is another communication. And then we want your stories, because that's something that's really powerful. So I tell you what, let me end by just letting you know that OSTILTS, on behalf of CDC, has reached out to primary care residency programs. We've got model curriculum that we've been putting out to the residency programs. It's been very good uptake from the programs. So all of your primary care residency programs in your states could be partners on Hep C with you as well, and we can help if you want, help get that message out and bridge that relationship.